All right, so this is the case of a 9-year-old with a sensory neural hearing loss. This is a young boy who came in accompanied by his mother. The mother was actually, right off the bat, unwilling to share the results from his previous audiogram, partially because she wanted a second opinion, but also she wanted to eliminate any bias that we would have as clinicians. She did give us a little bit of background, a little bit of case history. She reported that the child had actually passed several screeners in school and just recently had referred in one of his screeners. He has a history of issues with pronunciating words and some speech articulation issues for which he went to speech therapy. The SLP at the time determined that there may be something going on with the ears and not so much with articulation. She also reports he struggles with multi-step instructions and he doesn't always listen to his parents. And so she was trying to kind of separate whether this was maybe some form of ADHD or if it's simply just the kid ignoring the parents. He also has a pretty significant history of ear infections, and he's experienced sort of chronic congestion and seasonal allergies. Taking a look at the otoscopy and TIMS, both of those were relatively normal. Otoscopy revealed clear canals, visible TMs bilaterally. Tympanometry revealed type A TIMS. Everything seemed to be working fine at that point. And then moving on to the audiogram and a little bit of extended high frequency. So the audiogram revealed a normal hearing sensitivity from 250 hertz to 1,500 hertz, but then sort of sloping down to a moderate to moderately severe sensory neural hearing loss above 2K in the right ear, and a mild to moderately severe sloping sensory neural hearing loss above 1,500 hertz in the left ear. The mother was a little bit disappointed to see that these results were relatively consistent with the results that she got the previous month. For extended high frequency information, we got moderate to moderately severe sloping sensory neural hearing loss. So just to cover our bases, acoustic reflexes were performed. We got present responses bilaterally, and then we went ahead and did some DP-OAEs. They were present or reduced from 1 to 5,000 hertz, and then they were absent beyond 6,000 hertz bilaterally. And then the final thing we did was we sort of tried to assess the child's speech understanding in both quiet and in noise. So in quiet, we performed a word recognition test using a CID. Results were poor to good, so about 88% in the right ear, 68% in the left ear, when we presented at average conversational levels. Once we went ahead and increased that to elevated intensity levels, word recognition scores were good, 84% bilaterally. The final portion, we did a BKB SIN. It was apparent that the child struggled. He got a 4.0 dB SNR loss, indicating that they have a mild difficulty in background noise as compared to normative data. And then for our final recommendations, we recommended that they follow up with their primary care physician and any other specialty physicians. So that includes ENT, maybe some genetics, and then sort of review today's results. Secondly, and most importantly, we strongly recommend a trial with amplification to improve his communication and support in the school and in the home environment. As well as we sort of had the mother consider a trial with an FM system and implementing appropriate school accommodations to make sure that the student succeeds in school. Utilize strategies for improving speech understanding, sort of encourage face-to-face conversations, try to minimize some of those communication breakdowns that are happening at home. And then the most important thing, repeat audiological evaluations in 1 year sooner, or if there's any concerns and change in medical history or condition.